All right, now it's 11 o'clock. I think we should start this live interview with one of our very renowned teacher for teaching for the Academy of Acupuncture is Joshua Hurt. His practice is located in the Asheville, North Carolina, and Josh is eternal dedicated the student of the late Dr. Richard Tefutine. After he graduating in 2000 from Bastyr University with degree in acupuncture and the Chinese herbal medicine, he discovered the therapeutic value of the balance method and began study with Dr. Tan in 2006. He flew to Chicago for his first seminar. I think that is the place where I first met him. And since then, he has been committed to the application of the balance method in both his practice and his continuing education. As a lecturer for the Academy of Acupuncture, he seeks to reinforce the importance of the balance method as a critical tool of diagnosis and the treatment. Currently, Josh is practice the balance method acupuncture and herbal medicine in Asheville, North Carolina. And Josh is also the editor of my both book, The Power of the Points, Part 1 and Part 2. Let's welcome Josh. Yeah.
Thank you. Thank you for having me, Eileen. It's such an honor to be introduced by you and to have been able to continue to study with you like I'd studied with Dr. Tan.
We go way back, huh? How long I known you? Since 2006 almost?
2006 would have been when we first met, yeah.
Yeah, I know. That was, you look like you're only 16 years old. You still look like 16 years old. You keep your youth very well. What did you do?
I follow all the rules to keep myself as healthy as possible. And I also certainly have to thank my mother, because if it wasn't for her.
I like that. Good genes.
Yeah, I've got her genes. I'm wearing them.
Father is the chi, mother is the blood. Chi and blood, great clash, become a beautiful baby like you. Excellent. Okay, tell me, what is fascinating you about Dr. Tan and his balance method?
Well, the first thing that really captivated me about him was the results. You don't really have to say much more than that, because in your first class with him, you're captivated right away, just by the way that he commands his practice. And it's just inspiring to watch someone else and then to experience yourself the application of placing a needle and seeing a result happen right away.
I feel you. I know exactly how you feel. Excellent. Yes.
Yeah. So, he broke it down to just this simple 1, 2, 3 method for applying acupuncture. And it just reawakened everything that I learned in school.
Yes.
And, yeah. It's like any kind of strong experience that you have is just captivating. And then once you get a taste of it, you just want to keep coming back. And you realize, I realized even in the first class with him that I was just sticking my toe in the water.
Oh, got it.
Substantial that I could use right away. I understood that it was just the surface.
Now I understand. For the past so many years, 12 years, maybe, how many years? 12 years.
Yeah. Well,
or 14 years.
Since him. Yeah.
I think for the past 12 years, I see you all over the place. You're the fan of Dr. Tan, or people say you as a group of the groupie. Is that how people say that?
Yeah.
Groupie. I see you many seminars and following Dr. Tan around. That even though you're such an experienced balance method practitioner, why you still continue go back toe in the water? Don't you think that's good enough?
Well, absolutely. It's not enough. You know, you don't want, once you know, get a taste of something so excellent, you don't want to just put your toe in the water. You want to dive in and swim,
Ah,
right? So, you know, the logical core foundation, that just something that can be built on, and something that I don't think I'll ever stop learning. You know,
right.
I have learned a lot in the 14 years, but I'm not done learning. I'm not done making mistakes, and I'm not done, you know, finding new solutions and understanding in a deeper way.
Yeah, I can understand that you are learning the very basic to be able to build on. So that is wonderful.
Yeah, it was also very different, you know, in the aspects of, you know, for me, when I first went to Dr. Tan's classes, I saw the difference between making a meridian diagnosis versus what I had learned so far in school, which was more TCM, and making a TCM diagnosis and applying your acupuncture points based on that TCM diagnosis. So it really awakened me to a whole, you know, to what I felt was like really doing acupuncture. Because I understand, you know, TCM to be stronger with its application in herbal medicine. Not to say that it's, you know, irrelevant or not good for the application of acupuncture too. It's still great for that also, but it's maybe less potent than being able to do a diagnosis that's just based on the meridians, and creating a point selection that is just based on identifying where the problem is based on the geographic location.
Got it. Right, right. So for the past 10 years, you were a professor at the Taoist Traditional Chinese Medicine College in Asheville, North Carolina. And you have taught a range of different Chinese medicine topics, pediatric acupuncture, and you also teach pattern medicine, and you also teach herbal medicine. And why did you devoted your whole practice is still using the doctor and continuing spreading the benefit of the balance method?
Yeah, Dr. Han, I think that kind of comes back to what I was just saying about, you know, acupuncture and meridian diagnosis. So, you know, teaching pediatrics and teaching herbal medicine and teaching, you know, pattern medicines, obviously it's all herbal based. What we learn in acupuncture school, in order to pass our boards, we need to really understand that foundation. And it is an important foundation. And it's relevant to what we do with the balance method too. But in order to get good at with any tool, you have to use it over and over again. Study people that are better than you with using that tool. You have to observe what they do. And the balance method, to me, really feels like an acupuncture tool, which, you know, and it's a little different than the application of herbal medicine. It's blended with that too. It's not separate, but so when I was going through school, or when I was teaching at Taoist Traditions, I wanted to give students a taste of, there's a little more than what you're studying, but not overwhelm them, because they're already overwhelmed enough. They got enough, you know, new things that I'm, you know, feeding to them that they have to ingest and reproduce. I wanted to give them a taste of, well, why is large intestine 4 the command point of the head and face? You know, and to create some logical thinkings rather than just memorizations from the book.
Correct.
And that's really, you know, a big piece that I think keeps me coming back, that kept me devoted to continuing to study and understand, because it's the study that Dr. Tan did with the I Ching, and his ability to compile it in a way that is so readily passed to someone else to then apply is phenomenal. I often talk about in Chinese medicine, like it's got a huge long history, and people will say, well, how do you think acupuncture started? Who was the first person that, that thought of these points? And I said, well, my response is, I don't think it was necessarily one person. This is something that's been evolving with people for a very long time. Probably for as long as we stubbed our toe and we rubbed something to try to make it feel better. And it got more sophisticated and more sophisticated as time went on. And we had incredible people contribute along the way. And each of those people, creating a little bit more spark that create a little bit more of a flare of knowledge and evolution within the medicine. And that medicine is still evolving. And I think you, Dr. Han, and Dr. Tan are one of our current living sparks.
Oh. Thank you. I wanted to light every one of you because we are ready. We just need to know where can we start? Where can we continue? It's not just I got it. It's how can I be continuing doing this? Where's the result is proven? That is the most important part for the acupuncture because number one, we see all different patients. They have different illness. Every one of our treatment is not one disease with the same group of the points. We are tailor-made every single folding and every single cut that we need to do, just like making a beautiful suit for each one of our patients that make their health to run beautifully. That is the beauty of the balance method. You can use the strategy to fit into everyone. So we need to be a very good star plugs for all our patients. Just like all the acupuncturists need to have a good star plugs teacher to be able to light them up and they can start running the way they need to. Absolutely. Just such an insightful conversation with you. Wonderful. And I'm also very excited that you are going to teaching module 1 on July the 30th to August 1st. You will be in person and live streaming. Are you ready for us?
I'm very excited. And
with your experience of 10 years of teaching, I think this must be a piece of cake for you to help all the balance method practitioner restart their understanding of the balance method. So please, everyone, check the website, the Academy of Acupuncture training schedule. Josh will be here on the July the 30th to the August 1st, North Carolina and Charlotte, and you can come in person and or online learning. So now I'm gonna give you a challenge. I want you to present a case study that can mesmerize us.
Okay, I'm gonna bring up my iPad.
Okay, I can see you prepared.
Okay. Yeah, so I prepared a little ahead of time, so we would have some nice pictures to look at. And so this is a patient that I saw recently that was having pain in the elbow. So that circled area, very much small intestine 8. I mean, the point was that the area of pain was in the joint. On the inside of the bone was tender. The whole bone wasn't tender, but more on the side of small intestine 8, and the bone was pretty tender to the touch. And it had been causing her quite a fit and sometimes waking her at night. Another problem that she presented with at the same time was her knee. And she thinks that maybe it was aggravated from weed whacking, maybe that back and forth movement from using the weed whacker. And the pain was really right in the knee joint, like if you were to feel the knee and feel where the bones were connected, but definitely, coming right along the gallbladder meridian. Not a specific point here, not like small intestine 8. This was not like a meridian point. So what did I do?
1, 2, 3.
I did.
Got it. Now you give me a quiz so quick. I was almost not remember.
sick meridians were the small intestine and gallbladder meridians. I have a lot of choices, how I could treat that. For the small intestine meridian elbow pain, I could work with the knee and the urinary bladder, or the knee and the spleen, or the liver. Spleen and liver both have kind of a bony area, so that seems like could be a good idea. But then I also have to deal with the knee pain and the gallbladder. So I'd be looking at treating the elbow, and I want to get into the joint. So I'm looking at Sanjiao as a possibility, the heart, the liver. And then, as I'm thinking about it, well, how can I take care of this the most efficiently?
Yeah.
And what do I have show up on both sick meridians for a balance option? The heart.
Yeah, that's a great choice.
So I went over to the heart meridian and I started to palpate around heart 3. And what I found was I had to really feel the tissue to find where those ashi points were. But sure enough, if I felt for the cavity of heart 3, it was tender. And if I palpated more over to the bony side of heart 3, it was tender. If I just mashed in the middle, it wasn't so tender. But if I found those specific spots, it was tender. So I went for it. I placed the needle in heart 3 with the tip touching the bone, just gently. And then I placed the other needle at heart 3 going more into the cavity. And I had her move her arm. No more pain. I had her move her knee. No more pain. So 1 point, 2 needles, 2 problems.
Opposite side. I can see you did it.
Elbow treats the knee.
I can see you doing opposite side. That's awesome.
Opposite side, right. So if we go back, we would see that in system 3, we have to use the opposite side.
Got it. Yes. Wonderful.
Yeah. So
that is an awesome treatment.
Yeah, and that's one of the beautiful things of the balance method is as you start to really memorize the matrix of the point combinations, then you can choose less points.
One more time, because I think people may be missing that. One more time.
So one of the things that we look at when we're doing the needling is when the tissues have anatomic similarities, they have a more response. So when I placed the heart 3 needle in 2 different locations, I was looking for 2 different things. One thing I was looking for was for more of a cavity, which mimicked the depression of the knee joint, imaging that.
Got it.
And when I placed the second needle, I was wanting it to mimic the bone. I wanted that bony structure. And I had to search too to make sure that there was that tender spot there. So by touching the needle to the bone surface is giving the body the message that we're looking at the bone part. And maybe some of the fleshy part was helping with the elbow for small intestine 8 as well.
Got it. That's amazing. Thank you so much. I realize I haven't had a chance, when I teach, I haven't had a chance to using one location to treat 2 locations for the sig meridians. I mean, elbow and knee, and then you use the opposite side to use only one elbow. And you are very, very good at, I have to learn from you so I can teach something like this too more in my class. So that's a great idea. And thank you for sharing this beautiful case study. It's really amazing. Thank you.
Well, thank you for having me.
Yeah. So Josh, and it's almost the time that we have this interview. It's really short, only 30 minutes. Do you have anything that you'd like to share with us, that how we going to follow you, and how can we get to know you for all your case study? Is there any more case study that you can share with us in the future?
I'm in the process of compiling more case studies and doing some videos and stuff. I have to say that I have not had much time for that. I've spent a lot of time directing a large clinic, which I am no longer directing and putting more emphasis into practice and making resources available for other people. And I want to develop some of the teaching. So you have to stay posted.
Right.
as
Are you okay for me to ask you that, are you doing okay with the pandemic right now? Are your clinics still open, and are you seeing a lot of patients still?
Yeah, that's a good question. Yes, we are seeing patients. We have stayed open through the entire process, designated ourselves as essential service. We certainly saw a lot of slowing. Practice get quiet as it should, as people were not venturing out as much. But I'm back to seeing between 12 to 16 patients a day. So and we have rooms for everybody. So, and we've staggered people out. So we're taking a lot of measures with cleaning repetitively and making sure that the patients are further apart. We have slowed the capacity of the clinic down to help to address some of those issues. Yeah. But
I'm very proud of you, even in this pandemic, that you're still seeing that many patients, because it's very difficult. Most patients were hesitating to come to the clinic or any kind. And you still have this patient load that tells us that you did great job with all your patients. Even in this kind of situation, they still trusting you. They will come to your clinic. So I'm so looking forward for your class, that you can teach us so much, Jewel, about the balance method, that from your interpretation. So I am so excited about that.
What I wanted to say is what we have to offer as acupuncturists right now is so vital. People want it. And there's a lot of people who really need help now more than ever. From everything from the physical pain that they're feeling to the emotional pains that they're feeling from their lives changing. And
yes,
we have this beautiful tool that allows people to heal and reorganize without using any things from outside. Then we take out. So it's really the person's body doing the reorganization and changing. And I think that's an incredibly powerful thing at a time when we need resources that are simple to help people with their health.
okay. One more question. I know that you are treating the people who already passed their COVID after, so they are negative now. What is the leftover symptoms that you seeing the most?
I haven't seen too many people right now older that have had the fatigue and respiratory symptoms. Most of the COVID patients that I've seen have been in the younger population and were either asymptomatic or had acute loss of taste and smell. But fatigue is one of the primary things I've seen. I just haven't had exposure to people with the respiratory. We've been lucky in Western North Carolina in our amount of hospitalizations and deaths. So we are still a little bit of a bubble of a lesser population of patients that have been infected by COVID. So fortunately, I haven't seen as much what I've read about with some of the respiratory symptoms that last for months or weeks afterwards.
Okay, let me share that my experience with you was after COVID become negative. They're the number one, fatigue.
Mm-hmm.
They are so tired. Everything they move, even breathing, make them tired. They could not have a full breath. They are always very shallow. You know their lung is not opening. You can see that. That's the two symptoms primary. Fatigue, diarrhea, constipation, diarrhea, constipation. So they're alternating like that. They couldn't even have a decent walk. For example, you take your dog out, walk even for a half block, they have to come back and sleep for another hour. So that is a very severe condition that I am helping my patient with. So I like to please have you and everybody who's ever is on this Facebook inform all your people. This is not an easy virus that we can fix. I like to share with Josh, and people from Romania is saying hi to you, and also from Costa Rica, Paraguay, and Miami. Far, that's not too far, too very close to you, so they can fly up to see you. And also from Netherlands, they all come say hi to you. So you're very popular now. Before we let you go, and I like to also share with everybody that I do now have a new thing called, from Nepal. I'm sorry, there one from Nepal to say hi to you, Josh. And now, and I do also have a new idea, not a new, is a part of the 5R, 山医命相谱. The first part is how to take care of yourself, eat right, and how to drink right. And so hopefully you guys, after our Facebook online live streaming, go on to the Facebook of the Academy of Acupuncture. Then you can take a look. Mama Han, my mother, and teaching me how to cook the most beautiful, authentic Chinese, Northern China, briz, the noodle soup. So Josh, thank you so much to join us. And I will see you guys next time. Thank you, Josh. Bye.
Bye.